All right, let's dive right in. Today, we're talking about something that could be a total game changer for specialty nurses, AI. We're going to look at how this tech is helping some of the most critical pros in healthcare get back their most valuable asset, time. The idea is simple. Less time charting, more time caring. Let's see how it works.
This quote right here, it just nails it, doesn't it? If you're in the ICU, the ER, or any specialty unit, you know your world is just different. The stakes are sky high, the data you're juggling is way more complex, and you're making decisions in the blink of an eye. And the documentation, it has to be perfect, but man, it can feel like it's stealing you from the bedside.
So just think about this for a second. What would you do with an extra hour, maybe even more, every single shift? Seriously, what if you could spend less time staring at a computer screen and more time actually with your patients, using those critical skills where they matter the absolute most? Well, that's the promise we're going to dig into today.
Okay, first things first, let's frame the problem. We're calling this the documentation dilemma. You know what I'm talking about, that constant tug of war between giving hands-on care and the mountain of meticulous, legally required charting. This isn't just about paperwork. It's a huge part of the job that, let's be honest, can lead to serious burnout.
I want you to picture this scene. It's 2 in the morning in the ICU. You've got a vented patient, and you're seeing those subtle, worrying changes. Peak pressures are creeping up, O2 sats are dipping down, but at the exact same time, you're titrating pressors on another patient and watching a fresh post-op. Oh, and yeah, hourly charting is due for all of them. The pressure is just immense. And this, right here, this shows you it's not just a feeling. The numbers are staggering. We're not talking about a few minutes here and there. A critical care nurse can spend up to 3 hours a shift just on documentation. That's almost a third of your day. In the ED, it's up to 2 hours of what feels like speed charting in the middle of chaos. This is a massive, universal challenge.
So, how do we start to solve this? This is where AI steps in. And look, it's not here to replace your clinical judgment, not even close. Think of it more like a super efficient assistant, your new sidekick who handles all the tedious parts of charting, freeing you up to do what only you can do. Think critically and care for your patient.
Okay, let's make this real. We're going to jump right back into that high-stakes ICU to see exactly how this thing works in practice.
The secret sauce here, well, it isn't really magic. It's all about structure. A nurse simply feeds the AI the raw data points they're already collecting: patient info, neurochecks, vent settings, cardio data, what you did this hour. You're just organizing your assessment into a clear, simple prompt. And boom, this is where it all comes together. On the left, you've got those raw, fragmented data points a nurse might scribble down. On the right, the AI takes that info and instantly weaves it into a coherent narrative note. It even spots the trends, like the rising heart rate, and gives you a clear summary. It's still your assessment, your data, just documented in a fraction of the time. Okay, so that was the ICU. But what about the fast-paced, high-turnover world of the emergency department? Let's see how this applies in that controlled chaos.
Here we go. A patient comes in with classic chest pain symptoms. The nurse plugs in the key findings. Now the AI doesn't just list them back to you. It synthesizes them into a clear rationale for the acuity level. Check out that ESI Level 2 justification. It connects the dots, flags it as high risk, and documents the need for immediate action. That saves crucial minutes when you're staring down a potential heart attack.
We've seen the how, which is cool. But let's get to the payoff. What does all this efficiency actually look like when you add it up over a 12-hour shift?
90 minutes reclaimed per shift. Let that sink in for a second. That's an hour and a half. An hour and a half to double-check meds, to actually sit and talk with a patient's family, to mentor a new nurse, or just to take a second to breathe and refocus. This isn't just about being faster. It's about making the job more sustainable and ultimately improving patient care.
And this chart breaks it down even more. For an ICU nurse, you're looking at a potential savings of 72 to 120 minutes. For an ED nurse juggling triage, that's nearly an hour or more. The data's clear. This has a real, measurable impact right where it's needed the most.
But, and this is a big but, using a powerful tool like this means you have to use it wisely. So this last part is all about working smarter, not just faster. It's about making sure this tech enhances and never ever replaces your expert clinical judgment.
So here's the bottom line. The AI organizes, but you analyze. You absolutely have to maintain your critical thinking. You have to verify the complex stuff, like trip calculations and vent settings. This is all about customizing the tool for your unit and your hospital. And always, always remembering that your judgment is the final word. It's a partnership between your expertise and the AI's speed. And that really brings us to the most important takeaway of all. No algorithm, no piece of software can ever replace the skill, the intuition, and the compassion of a specialty nurse. This was never about automating care. It's about liberating you, the caregiver, from the crushing burden of documentation. The goal is simple: to help you document your irreplaceable expertise more efficiently so you can get back to doing what you do best.